సమాచారం కోసం 95 న్యూస్ ఇప్పుడు యాప్ లో మీ ముందుకు వచ్చింది. వెంటనే డౌన్లోడ్ చేసుకుని న్యూస్ అప్డేట్ తెలుసుకోండి. ప్రతి క్షణం ప్రజాక్షేమం కోసం.
I want to transfer this trauma of pelvic pain to her. At least, hopefully, in my family, I can break this cycle. So, yes. So now, let us come back to the topic. I want to talk about my family issue, which have been working greatly to discuss this topic, enlighten women about this, and this issue can be more and more brought to light. So how can we not talk about our founder and director, Dr. Astrology, when we are talking about Second Heart Physio Foundation?
She is our entrepreneur, founder, managing director of Second Heart Physio Foundation. Ma'am, I welcome you all to the live.
Please. Ma'am, we need 2 words. I know you said no, but chill.
Good evening, one and all. First of all, I would like to thank, I should say, my parents to begin with, for giving me this opportunity to believe in myself and take things forward. And secondly, coming back to the topic of pelvic pain management, this has been a concern for many decades, passed by generations, and nobody really speaks about it unless somebody is really in deep dark pain. And even though they speak to few people, they don't find solutions about it. So there's no point discussing on problems. We want to work on solutions. So then I thought, why can't somebody take a step forward, be there, go there, look at the solutions. What are the possible ways that one can take up this kind of topics? Then fortunately I had the exposure, and I had my team, my mentors, well-wishers, my patients, everybody came forward and said, yes, we are in this, so let's do this together. So that's where we stand here. And I would like to also thank Jay and Alane for coming down, flying down all the way. So, and I had wonderful interactions with them. They've been wonderful human beings. Look forward to listening to them. And thank you, team, for making this happen. Thank you, everyone, for coming all the way, believing in the concept. And we would like to look forward to working together. Thank you. Thank you so much.
Thank you, ma'am.
Now, let's move on to our next segment and not delay. As I've told a very long story about chronic pelvic pain. So let us call the pioneers in this field. I would like to call upon stage Dr. Alime Bayog and Dr. Jay Shah, because I feel I will not be enough to introduce them of their achievements in the field. So I would request Dr. Alime Bayog and Dr. Jay Shah to please come on the dais. Dr. Alime Bayog is the pelvic health and clinical investigator in the field of pelvic floor health in the Faculty of Health Sciences Department at Turkey. She is a member of International Pelvic Pain Society and co-founder of International Pelvic Health Institute. Alime, please. The stage is all yours.
So today I want to tell about what I'm doing in Turkey. So did you see my bag? First of all, I want to see that. I just want to ask, did you see my bag? Is that nice? How is it looking? It's lower or is it similar? Did you recognize what is that? Exactly? Yeah? I wanna see the man. Did you see exactly what is this? Yeah? Can you see that?
Okay. So I want to tell you the story behind what I'm doing as a researcher and then why I'm talking in here. I'm not a formal speaker, I'm sorry if I bother you, but let's try to do my best, okay? My name is Ali Mebriyuk and I'm coming from Antalya, Turkey. And here is my university. I'm going to change my slide. How can I do that? Okay. Here is my university, Akdeniz University. I'm working in there. And since 2017 as a researcher. And I'm working as a public health physiotherapist. But the thing is, making research sometimes it's really boring, right? Because you're collecting data, writing, but you couldn't share. I just want to share with people. And then I realized that, okay, how can I share my knowledge? Patient education is really important in our field. You need to tell first, okay? You need to tell your patient what she has, what's going on about her. Then it's not enough for me. Not enough for talking patients. Then I move my talk, my patient education to the bar and I call back to the pub. And I create my own pub crawl, okay? And in Turkey, I did it in Turkey. Just last year in Denver, in States, they invited me to tell how I did it in Turkey. Because we have a very conservative community and we are announcing as a Muslim country, right? I'm a Muslim girl as well, not practical. But I just try to, tell and then do my best. So we started to teach in Turkey some pelvic health class. You can see Jay Shah from here, just between the participants, and 2 different courses in Antalya and Istanbul. So we started to host our mentors from all over the world, UK, US, Canada, Germany, and then last year I was in Bangalore. Last year I was in Bangalore and I just met this Archana in the Indian Myofascial Pain Conference. So that's why I want to come back again and then share my maybe experience with you and maybe support you also, friends, to open your horizon a bit, maybe increase your awareness a bit, because pelvic health physiotherapy is very important and it's really important to work with MDs, physical medicine people, some gastroenterologists, gynecologists, urologists, and even in pain medicine too. So just because of that, I created some pelvic health courses all over the place. Now we come in retreat because our colleagues also need that. Do you know how many participants have pelvic pain issues, painful sex, even constipation? Like defecation with pain and dysuria, that means pain in the urination or after birth injuries. We are suffering from that. Male and woman, both genders, they are suffering from pain. So that's why I put my courses in retreats. And then our colleagues started to heal their self at first, and then we just spread all around Turkey, and then just treating our patients. So I just did my studies on that. This is my PhD study, which made in chronic pelvic pain patients. And then I did a couple of studies, you can see that, but I just don't want to mention about my boring studies, okay? I want to just talk about you, what you are doing guys in here, okay? Because this is me, I'm just briefly introducing myself. I will introduce my mentor, Dr. Jay Shah as well. And I want to hear from you guys. Who are you? What are you doing in here? Why you are here? And what you are wondering, what's your questions? We want to hear that, okay? So it will be an interactive talk after all. So thank you for coming in here today. And I just want to emphasize that we have a society that's called International Pelvic Pain Society, IPPS. If you're MD, physical therapist, massage therapist, or homeopath, please be member of that and just be part of it. It's centered in US, but they are very open-minded. And I'm working as a liaison committee member for Turkey, like an ambassador, public pain ambassador for Turkey. So just come and join us for that society. So you can see on my next slide, those are all what I did. I just don't want to mention about that so much. We were together just 5 months ago, right? In Bangalore, yeah. And here is the society, Pelvic Pain Society. You will see that it was in stage, guys. And then I just talked and I just jumped over the stage, and then I just started to talk in here, right? Because just before me, there were Stanford University is talking, okay? Yale University, Harvard University was talking. They are so big, okay? They did like cellular microdialysis studies. What I'm gonna tell them? I'm just gonna tell them what I'm doing in Turkey. We are just giving patients time. We are listening them, and then we just find a solution to them. That's all. I can do that in my country, okay? I don't have molecular devices. I don't have technologic devices in my country. I have my own hands, knowledge, and then I have time to just, listen and understand them. I think this is the most important section. That's why it creates a great impact. And even I wear my vulva vest in there. They were shy. They were looking at me and then they just don't want to look it. Is this what? Right? I want to emphasize it. I'm wearing this vest because it's made by Alisa Skolo, the Russian artist. That emphasized that every vulva has a unique shape, like, fingerprints. And there are increasing rates between, especially adolescents, between young girls. They are getting vulvoplasty. Okay? They're just changing their vulvas, and then they just one shape vulva from their gynecologist. It's very sad. So why? Because, media, all the other maybe cosmetics, they have some concerns all about that. So we need to get the best knowledge to them, I think. That's why we need to talk about it. We really need to talk about today vulvas, penises, sex, sexual function, dysfunctions, and pain. So that's why we are here. Okay? Thank you.
So I also wish to echo some of the sentiments that have been shared by the speakers this morning, this evening. And I want to emphasize a couple of things. So my background is in physical medicine rehabilitation. I'm a physiatrist. I've been doing clinical research. As Alka was saying, there's sort of this dark history about chronic pelvic pain. It's interesting if you think about it. Many people are not aware of what myofascial pain is. And if I ask the audience, I bet I would hear different answers. People may not even know what a trigger point is. Imagine then if women are having chronic pain and they're having a condition associated with trigger points and what's called central sensitization. And the patients, their physicians, their therapists don't know anything about it. So how do we even educate? How do we even explain to our patients if we don't have that working knowledge about clinical terminology and the understanding that the neurosciences bring to the bedside? And that's where this teamwork has been established. And I like to emphasize that because I've been teaching workshops for many, many years in many, many countries, too many to name. And in 2019, I was invited to teach a workshop in Istanbul. And the person who invited me said, "Oh, look who just walked in. That is Turkey's expert on chronic pelvic pain." So I look in the back of the room, and of course I'm expected to see a gray-haired man. That's why, I'm just sharing my presence. And I'm looking, all these 20-somethings. So I'm saying, who, where, what, who? She said, right there, right there. Who, what? Ali May. And so, I said, oh my goodness, really? So, and I met Ali May, and I was so impressed by her knowledge, her passion, her enthusiasm, and how she has taken really going from the lab to the pub, the lab to the pub. In other words, what is the information that is being drawn from the clinical and basic sciences that can then be taken into the laboratory, into the bedside, but also how do we educate the populace, right? In pub talks, in informal discussions. So that's why, as Ali May said, we don't want this to be she and I just giving a lecture. We want to make it interactive. Yes? We want it to be a discussion because I'm originally from India. I was born in Mumbai, but I've lived in the States for many, many years. My wife happens to be from the South, India. But I don't know what is practiced here. We don't, Alini doesn't know. Archana has given us some information. But what we do know is too many people are suffering needlessly. And that is a travesty. That is an absolute travesty. And I think the passion that Alka showed, that is what we need. And if I cannot emphasize enough this point, and I'll be talking about this in the workshop this weekend. Trigger points are essentially these painful nodules. And most people assume that trigger points are caused by muscle overuse or muscle damage, right? You could say I played tennis, or I was playing football, and I injured my muscle, I may have some trigger points. That may be the case. But we also know that trigger points can be caused by what's called central sensitization. In the absence of injury or overuse or damage to the muscle, there are innumerable somatic, visceral, and neurologic conditions associated with myofascial pain. Why? We are doing the research on this. We're going to answer this question. But the answer to that question, in your minds as clinicians and as journalists and others, should be to say, okay, if someone is having myofascial pain that's not being caused by muscle damage or overuse, what could be the cause? It could be central sensitization, which just means lowering of the threshold of the nervous system associated with some disease, whether it's endometriosis, cystitis, asthma, it could be infectious disease, it could be cancer. Do you see where this is going? So our message to all of you, all of the people in healthcare, please communicate with each other. If you're a physio and you're seeing myofascial pain and the patient does not improve, you keep treating them over and over again, you need to work with the doctor and ask them, what could be causing the perpetuation of myofascial pain? And vice versa. As physicians, we need to understand and embrace non-invasive, non-pharmacologic therapies because they can be enormously successful in pain management and in empowering our patients through education, using biofeedback, relaxation, etc. Now, I said I wasn't going to give a lecture, but I'm giving a lecture, so I'll stop. But thank you for coming. We appreciate it.
I want to start with, you guys, okay? How many people in this room in between 20s? 20s, wow, well, maybe, not bad. And how many people are 30s?
No, you should ask me to reframe the question. How many people feel they're in their 20s?
Okay, everyone.
Okay, good. I want to see that. Good.
Love it.
Yeah.
How many of us in their 30s right now? 30s? Yeah? Great. This is my, most favorite population, by the way. So, how many of us 40s? 40s? They know everything, okay? They are experienced enough. They experience life, right? 40s? Any 40s?
You said 40.
40s,
Yeah,
okay.
That was 40.
Okay. How many of us now 50s? Look at them, they're looking so young, okay?
Yeah.
Two people?
Yeah.
What about the bedside day?
Keep going.
Okay, 60s. What about 60s?
Right here. Yes.
Oh my God, that's
Right there.
awesome.
Good.
You're the first person who watched my show in their 60s. Wow. It's in India. Look at it.
Yeah.
It's in India. Amazing.
Well, this is my first time at your show too.
Oh, that's right.
I'm in my
Yes,
60s.
that's right.
Yeah, okay.
Yeah.
We're
But
team.
you feel just fine.
I feel much younger.
Okay.
Because I'm very passionate about what I do. My clinical research is what we teach together. Yeah, absolutely. Yeah.
So how many people are medical in that room?
You didn't go higher than 60.
Yeah?
We should make sure we
Yeah,
don't limit
yeah.
anybody.
It could be.
Okay.
How many people are in their medical field? Let's say physiotherapy, doctors, MDs, medical? How many medicals we are? Okay. Yeah, okay. You're okay, guys? How many of them are doctors? MDs? MDs? Okay. Oh, MDs. Okay. Great. So how many journals we have? Journals? Okay, guys? Great. So how many acupuncturists?
Anybody here do acupuncture?
Acupuncture?
Acupuncture? No? I do
No?
acupuncture.
Okay.
Okay.
So how many pelvic health physiotherapists in here?
Archana?
Archana?
Pelvic health
Physiotherapist?
physiotherapist. Archana? Anybody else?
Archana?
No.
Good. How many sexual therapists in that room? Or psychologists?
Psychologist? Yeah.
Psychologists?
That's it.
Are you looking for sexual issues as well? Dysfunction, penetration issues? Great. Great, ladies. Okay. So what about you guys? What about you guys?
You didn't raise your hand. What are you?
What is your expertise? I really wonder.
What? The journalists. Oh, they didn't raise
You're
their hand.
journalists.
Sure.
Okay. How many journalists do you have?
How many journalists? All the hands.
I
all the
really
hands.
want to see that.
Okay.
Yeah?
1, 2, 3,
Okay.
4.
Great. Great. Okay. So it's a quite mixture of, colleagues and MDs and the other, workers. So let's see how it's gonna, go.
Okay. Yeah.
Okay. I just want to ask, do you know what is dyspareunia mean?
Dyspareunia. That's your son. Can anyone define what dyspareunia means? Anybody?
I will give it to you.
Okay.
That means painful sex
Intercourse.
or intercourse.
Painful sexual.
Yeah, sexual intercourse. Have you ever experienced dyspareunia in your sexual relationship? I just want to ask that. Have you ever experienced sexual dyspareunia? Yeah. Just 2 people? You're lucky?
You're lucky.
Or liar? Or maybe liar? Right?
Not the people who answered.
Yeah.
I mean the people who didn't answer.
Yeah, I didn't answer. Lucky. Right? Great. So how many of us, man, I'm just asking you, how many of us didn't control your urine, maybe your ejaculation, maybe your gas issues, It's all about pelvic floor muscles, all related there. So have you ever experienced premature ejaculation? That means, how can I say that?
Yeah, you got it. Premature ejaculation.
Premature ejaculation? Have you ever experienced in your life? Ever? Never? Never? No? You didn't experience at all?
She said yes. She said yes.
Very honest man in here. I love it. Okay. Rest of it? So, studies have shown that 30% of women experience painful sexual intercourse, and just very same ratio of men has also premature ejaculation. That all means controlling our muscles, and that muscle is just going that in our sitting bone that we call pelvis. Let me show you. Okay, guys, just meet with her. She's our pelvis because it's a female pelvis. Okay. When we remove that region, we call genital area. All pelvis are almost same, men and women, and it's surrounded by muscles. How many of us experience constipation? I just want to ask that. Any constipation issues? Because constipation? Because Indian foods are healthy, right? Yeah? Very good. So, pelvic floor muscles are just placing between your sitting bones and your coccyx, that we call, in the very edge of the back, tailbone, your tailbone between your, the pubic bone. And then they're just helping you hold it for urine, gas, and your rectal continence. We're just telling these all those functions to our patients, and that we are calling patient education. We all aware of as if you're MD or if you're medical practitioners, but our patients most of time, they don't know what's going to happen in their treatment, what is happening in their muscles, why she is leaking, why she has painful sex, why she couldn't accept the penis or get the intercourse.
Alime, can you add to those points the concept of sensitization in the context of what you're discussing here? I will talk more, but if you can discuss it a little bit and trigger points.
As a physio, we are always treating muscles, and it's recurring pain, and always complications again and again. Once, twice, third time in our clinic, there's just almost, recurring pain is happening. So why it's happening?
Hello, good evening, ma'am. Please, today we discuss about chronic pelvic pain. Please give your introduction, please.
Good evening, everyone. I'm Sri Pooja Siddhamsetti. I'm a clinical psychologist. So, there are many people who come to us for saying that they have abdominal pain. They will not clearly tell us that they have a pain. So then when we see it's a gynecological reference, then we sit and ask them a lot of case history. See, in counseling what happens, we just ask them how is the pain and how are you coping with it and all. But as a clinical psychologist, we take case history, we take detailed history, we see if they have any stress, depression, anxiety, and sometimes they don't report any of those things. So then we tell them that sometimes the pain can come due to, certain factors and how you can help them. So today's event is on physiotherapy and the physiological part of it. So physiological and psychological, they both are interconnected. Biological perspective is what we'll be also looking at. So it's very important for India to have such awareness about this program. And I really thank Dr. Archana for coming up with this initiative, Menarche to Menopause. And women have to speak up, and men have to be understanding. The best we can do, yes, best thing you can do as a man is to understand. You cannot experience it, but if you can understand and help the lady in your house, it could be your sister, it could be your mother, your friend, and that's when you can, the woman will feel more comfortable to share. And the pelvic pain may not be that much of a pain when stress can be shared.
This pelvic pain usually caused during the pregnancy time, post-pregnancy or pre-pregnancy. What time it will?
See, basically, as a psychologist, I'm saying, not as a
Clinical doctor.
not as a MBBS doctor. So the pain could be for various reasons. But the woman should feel comfortable enough to say, I'm having this pain and I need to visit the doctor. And she should be comfortable enough to go and talk to the gynecologist and tell them that this is the pain I'm having.
Okay, it's a fine.
Yes.
What is the role of your psychologist in this type of case?
See, role of psychologist is we do cognitive behavior therapy, where the cognitions, the thoughts that are coming for the person, we all get thoughts, we are all human beings, but those thoughts could be negative also. So we check what is the kind of behavioral patterns they are having along with the thoughts. And then we work on alternative thoughts, because thoughts are distressful. The stress comes from the thought. Yes. So then we look at relaxation therapies, the various relaxation therapies. Then we suggest a lot of lifestyle changes, exercises, mental health practices that they can start. And, we are all social human beings. So being able to communicate our feelings.
With social psychology also we can eradicate such type of problem.
Yes, yes.
That's true. Okay, thank you. Hello, good evening, ma'am.
Good evening, sir.
Please give your introduction.
I'm Niharika, sir. I'm working as a clinical psychologist in Delta Health Hub. So, our Archana ma'am is organizing this conference on chronic pelvic pain.
Hello, nice to meet you, doctor.
Nice
Now we'll discuss about the sexual dysfunction.
So,
Can you explain about that?
so sexual dysfunction is the ability to not perform or feel arousal or pleasure sexually, and it can be due to both physical and psychological reasons. So, right now, physiotherapy conference is going on, so they're discussing the physical impact of it or the reasons for it. So, as a clinical psychologist, we usually deal with the psychological impact or the reason for it. So, for example, if a person suffers from performance anxiety, so it can give them anxiety or stress to an extent that they experience dysfunction. They cannot perform, or they feel extremely anxious, and they do not prefer to perform. Or sometimes the mental health is so deteriorated that they cannot perform. So it can go both ways, where dysfunction can cause mental health issues, and mental health issues can also cause dysfunction.
Very nice. So, how we can prevent the such type of diseases?
So the main point is awareness,
I will ask
especially.
you, is it a disease? We can declare it as a disease, this one?
It also depends on the biological factors, sir.
Okay, fine.
So if the biological factors are involved and there is a clear diagnosis of any organ or any tissue not functioning properly, so we can call it a disease. If only the psychological aspect of it is involved or physiotherapy aspect of it is involved, so we may not call it a disease. It can be called dysfunction because it causes distress in life, and we can solve it with simple counseling or therapy sessions.
Thank you very much. Good evening, ma'am. Please, today we'll discuss about the sexual dysfunction and sexual disorder. What is the difference in between them?
Okay, so sexual dysfunction is look at it in a very simple way. Sexual dysfunction is the person might be having difficulty in getting an orgasm, or having any sexual satisfaction, or having pelvic pain, sexual pain, and all that. Now, sexual disorder is where it's like chronic, like like a healthcare professional, gynecologist or a neurologist, they will let the patient know that it's a severe disorder. I'll give you an example. Sexual dysfunction is like a headache that you might get occasionally, but sexual disorder, you can look at it as a migraine, that it's like a lifelong kind of a problem.
That sexual disorder will be the headache, migraine, or something.
You can call it like a migraine,
Call it as a.
like an example.
Okay.
How difference between headache and migraine.
Okay.
In the same way, difference.
This will cause in both male and female, or only female?
Both male and
Both.
female, both will have different kind of problems.
The census, what it will say, it will cause in the male more or female?
See, male have external organs, female have internal organs. So both have different kind of pain and problems.
Okay. Can you some more focus on the sexual this dysfunction?
Okay. Now, sexual dysfunction is specifically in India. We do not talk much about sex or any of those kind of problems. So, if someone has any problem, they do not even know that they are having a problem. So, first, some of the tips that I can give is to be positive. Talk to your closest people. If you feel uncomfortable, do take an appointment from a doctor. Go ask all your questions there. What if your problem is not serious? And you can resolve it with an appointment.
Yeah, that's true. You said it is not awareness in all the people in our country. So, how to make the awareness in the public? Through media, through journalism, or how?
It all starts from home. If you are comfortable to talk to your mother, your father, your relatives, or your own siblings at home,
Husband or something.
husband,
Wife.
grandparents, someone might scold you, go to another person, you have a problem. Now we have Google, but we always suggest you not to go through Google and all that. Always take a doctor's point of view, but always share openly. And it all starts from sharing your feelings. When you can share your feelings openly, this is also one of the feeling that you can share.
Thank you very much, doctor. Nice to meet you. Now we are going to take the interview with Dr. Nirmala. She worked in several sectors, even in states. Now we'll ask about the pelvic, chronic pelvic pain, about what's the causes and what the reasons. Please, can you explain, ma'am?
So pelvic pain is something which is very less spoken of in our country particularly, although the experience is there definitely. A lot of people have this problem, but it is a matter of shy and people are not comfortable speaking about in open. That is the reason we all come together to spread awareness about the presence of this condition and encourage everybody to come out and speak about it. So pelvic pain is something which many people experience for various reasons. Few of them are diseases which can be corrected, and most of this is because of nerve conditions or something what we call the sensitization of certain points in the brain, where the pain continues to be felt and perceived. So that is why we are here as a team of gynecologists, urogynecologists, urologists, physiotherapists, and pain physicians.
Okay. This will occur only in the females?
No, pelvic pain can happen in men as well, but it's more common in females.
Okay. So it can be cured by the physiotherapy?
Physiotherapy has a very big role, but it is not the only thing that is involved in the treatment of these people. So I would not even call them patients, because it is a very common condition. It is not only a disease condition. So physiotherapy has a very important role. Other than that, the medical treatment is involved and the pain physicians are also involved.
Usually we listen this type of pain, pelvic pain, in the pregnancy time, during pregnancy, after pregnancy. What is the cause?
So mostly few diseases which cause inflammation, that is a body reaction to a disease condition, that is the cause. And sometimes it is some nerve damage, and not only in pregnancy. If there are some problems existing even before the pregnancy, they can happen. And after pregnancy, if there has been some muscle damage during delivery, or because of some abnormal conditions that crop up during the pregnancy, some neurological conditions usually. So those are the problems for chronic pelvic pain or injury at the time of delivery.
Okay, thank you very much, Dr. Nirmala Garu. Hello, good evening, doctor. Just I want to know about the pelvic structure and pelvic pain. Please, can you explain?
Yeah, pelvis is the bony cage which is present in the lower part of our body, connecting the lower limbs with the abdomen. So this pelvis has various joints like sacroiliac joints, which has the both lower limb connection with femoral heads and all. And also we have the pelvic diathesis, that is the connection in the center of the pelvis. And at the back we also have iliac crest, iliac bones and all. So this entire thing completes the round of the pelvis. In this pelvis, what are the important or vital organs? The vital organs in the pelvis, we can say all the organs, whether male or female, but all the vital organs like urinary bladder, lower parts of the ureters, and also in men you can say the prostate is there, and in women the uterus, the cervix, as well the fallopian tubes, apart from the connections to the fallopian tubes and the ovaries. These are the important organs which play vital role in reproduction of male
Reproduction,
and females.
excuse me, doctor. In reproduction it's okay, but the pelvic pain, these ovaries and fallopian, these will react or something?
Yeah, definitely. When these pelvic muscles are not perfect, the strength of the muscles is not up to the mark, definitely these joints are going to be lax and these parts are going to come down. These drop of important organs like uterus down, we call it as prolapse. So that kind of prolapse is going to affect the functioning of these pelvic organs, and so that even the urinary bladder is also present in the pelvic structure. So any problem or any disturbance in this pelvic musculature is going to cause urinary incontinence, that is dribbling of urine. And as many joints are available surrounding this pelvis, all these joints are going to give you severe pain.
Okay, why usually this will happen in the during pregnancy, after pregnancy?
Yeah, definitely. It's a very good question. Why this happens in pregnancy? pregnancy is a period where the baby grows in the pelvis from 0 to 3 kgs. And this pelvis is going to bear the weight of the baby as well the placenta, the fluids, amniotic fluid and all. So this kind of pain it generates, and in some patients it continues. That is the reason why there is knee joint pain when for the people walking for longer hours or climbing steps more, because the weight is being borne by the knee joints. In the same way, the pelvis bears the weight of the baby and all.
Okay, after pregnancy, is there any bones will become weak or muscles will become weak? What is the reaction of that? Please, can you explain?
After pregnancy, definitely the muscles will become weak because of the weight bearing of the baby and associated things in the abdomen as well. Apart from this, weight bearing, the hormonal changes also occur in pregnancy. Certain hormones go to lower level and certain hormones go to upper level. Like progesterone goes up and other hormones will go down. So this progesterone, the effect of progesterone is to create some disturbance in the joints, like laxity of the joints.
You are a internal medicine doctor, what is your role in this one? Pelvic chronic pain.
My role is to educate the patients who are going for pregnancy that you may encounter these kind of problems. So when you plan your pregnancy, definitely take care of your pelvic musculature prior only. As everybody knows, prevention is always better than cure. So please concentrate on your pelvic musculature, strengthen by doing exercises, and you can build up the power in the muscles so that you can handle your pregnancy properly. And when you get the symptoms after pregnancy, please don't ignore. We have a lot of institutes like Second Heart Physio, which is running a training course and treatment courses for these kind of problems. So you can take the help of them.
Okay, thank you very much. Very nice interview.
I am Dr. Pratima Raj Reddy, Professor of Internal Medicine, working at Government Medical College, Nizamabad, and also working as a Medical Superintendent of Government General Hospital, Nizamabad. Today I am here to speak about pelvic dysfunctions in women especially.
Good evening, doctor. We'll talk to one of gynecologists. She will explain you about the chronic pelvic pain.
I am Dr. Padmaja from Omega Hospitals. Chronic pelvic pain is such a common condition where most of our patients come to with the same complaint. The causes may be endometriosis, sometimes undiagnosed cancer, or dyspareunia, or any pelvic inflammatory disease. Depending on the cause, and after diagnosis, we treat them. See, we have got a pain clinic now in Delta Hub, where in addition to all the medical conditions, they are giving a very good physiotherapy and exercises and promoting pain relief to all the people.
So with the physiotherapy, we can control the pains.
Yeah, first once all the medical conditions are excluded, suppose if the pain is due to cancer, after proper diagnosis and investigations, we refer them to physiotherapy where our treatment is over and still they have some physical issues like due to muscle pain or any injuries, sports injuries or any other common factors.
So this will be usually in the female. We'll find the pain in the female, particularly in the during pregnancy time, post and after pregnancy.
During pregnancy, some women complain of sciatica or any hip pain because of pressure on the pressure due to the uterus. This also can be treated with physiotherapy and local applications. Sometimes physiotherapy helps in such conditions, but complete relief comes to them after delivery only.
Okay, so for example, this fibroids and ovary problem, this will be cause
fibroids, and that is also a cause of pelvic pain where that is treated with surgery. Physiotherapy doesn't have much role when there is a clinical condition like fibroid or pelvic inflammatory disease or any other medical condition.
Okay, thank you very much, doctor. Nice to meet you. Hello, good evening, sir.
Good evening.
Yeah, welcome to Second Heart Physio Foundations. We would like to know about the pelvic pains and about that one. Please, can you explain what?
Yes, of course. So first of all, thank you for hosting this event. My name is Jay Shah, and I am a doctor of physical medicine and rehabilitation. And my interest has been for many years in what's called myofascial pain. Myofascial pain is associated with what are called trigger points, these muscle nodules. And women with chronic pelvic pain have lots of myofascial dysfunction, including trigger points in their pelvic floor muscles, in their extrapelvic muscles. And what Alime and I are doing is trying to teach our colleagues, our associates, our students, how to
What are the
assess and
reasons?
evaluate.
What are the reasons to cause this pain?
So many things. It could be caused by stress. It can be caused by organic disease. It can be caused by muscle dysfunction. It can be due to cystitis, endometriosis. There are a number of musculoskeletal conditions and visceral conditions, such as organ disease, that can cause chronic pelvic pain. Our challenge is to identify the cause and try to treat the mechanism of the pain.
Treating mechanism by physiotherapy?
By many modalities. One can
drug-
use physical therapy. One can use physical modalities like electrical stimulation. You can use biofeedback, relaxation. You can use medications. You can use manual therapy, behavioral management. Chronic pain in general requires multimodal treatment, and it requires experts from different backgrounds assessing the patient. This could be psychologists, therapists, physicians, nutritionists, etc.
Okay. It will cause more in the female or men?
Well, chronic pelvic pain occurs in both men and women, but it's much more prevalent in women than men.
Because of their pelvic structure?
Partly because of pelvic structure, but also partly because of biology related to the neuroendocrine system and the gynecologic system in the body. So they're more vulnerable to developing chronic pain associated with dysfunction at different points, whether it's pre, peri, or postmenopausal.
Yeah, the treatment can be useful for this.
Absolutely, 100%. Yeah,
Okay.
but not just treatment, proper assessment, and most importantly, is communication among healthcare providers. That means medicos like myself communicating with physios communicating with medicos. Yeah,
Okay.
in the assessment of patients. Yes.
Okay. Thank you very much.
Thank you.
Hi friends, welcome to our channel. From Turkey. We'll discuss about the sexual disorders. She came from Turkey. Madam, congrats first of all, and welcome to our India.
Thank you so much. This is my second time in India. I'm
How are you,
quite
madam?
excited.
How are you?
I'm fine. Thank you so
Madam,
much.
tell me, how is our Indian food and everything?
I really like your culture. Yeah, to be honest, I really like your food as well. It's a little bit spicy, but I really like it. Yeah.
Madam, will you please explain about the sexual dysfunction? About what steps are going to conduct in our country and what steps are going to develop in our country?
So, we did a quite challenging revolution in Turkey, especially in sexual function and pelvic health physical therapy. I just want to tell my journey, and then if you able to just, have a listen what we did during 8 years, it will be perfect for us.
What are the implementations done in your experience, madam, in Turkey? Implementations. What implementations you've done in Turkey?
Oh yeah. So as a physical therapist, we just opened a new field for our colleagues, and then we started to host our mentors in Turkey, and then now it's around 2,000 pelvic health physiotherapists in Turkey. So they treat patient to patient, and then we just spread all around the Turkey right now.
Will you please tell about the pelvic floor dysfunction and what about the pain management? What steps are going to implement in our country about regarding pain management?
Yeah, pelvic pain is underestimated issue, unfortunately, in medical staff. But the thing is, it's getting aware. Every medical doctors and physiotherapists, and even in rheumatologists in that field. So people are just raising their awareness. What is that exactly? Because in research, some literature research shows that patients needs to go at least 7 doctors just apply for us. So that's very, that's very worrying things for us, because patients cannot reach directly to us. But our aim is raising awareness, just defining what is pelvic pain. Pelvic pain is pain in that area. So in between, umbilical and lower extremity part, we call it here pelvis. I'm going to show you with my model, and that pain is called pelvic pain. Every woman and man population just had that issues.
Coming to awareness of the patients, madam, how you will treat and how will how will get provide awareness in your country, madam. In India, actually, what will happen in India means if you give any treatment or medicine, they won't follow. Certainly, 80% people they won't follow the instructions of the doctor. How will give awareness and how you will develop awareness in your country, madam? Most probably, I think 100% they will follow.
Yeah. Same in everywhere. Even in Turkey, our patients are a little bit, little bit lazy. Yeah. In fact, to be honest. But the thing is, I think is patient education is very important. When you tell them what exactly they have, that's the thing, that's the cue, I think. And then they just started to do their massage exercises. I think this is the cue. I can say that patient education. Just tell them what they have and what they need to do.
Thank you very much, madam. Thank you for your suggestion. Thank you.